So what can you do to protect yourselves against the coronavirus? Well, there are many things that have been said already. You can take a distance, wash your hands, and be with sterile solutions all the time. But what is really important, next to all what has been said and all the measures to stay at home if you need to protect yourself, is that you need absolutely to put water in the air of your living. We use humidifiers. The only reason that there's much more viral infections in the winter than in the summer is that we overheat our homes and we forget to put some extra water in it. So our mucous membranes of the respiratory tract gets dried out, very thin, and the virus comes in very easily. So what you should absolutely do, and we do that at our office, we do it at our homes here, we put more humidity. You need to have something like 65% humidity, and not the 30-35% there's probably in your home in the wintertime if you don't humidify. So this is extremely important. This will make the biggest difference. Then the other things is that we use also nutrients. We use nutrients like vitamin D, vitamin C, vitamin A, and the zinc to stimulate the immune system. Vitamin D, following Dr. Brownstein, a famous physician in the United States, it's like 50,000 international units you take during 5 days if you have the coronavirus. But if you want to protect yourselves, 10,000 international units should be fine. Vitamin A is between 25,000 and 100,000 international units of vitamin A you need per day to stimulate your immune system. And if you have an infection, you can increase the dose, 100,000 to 200,000 during also 5 days. That may really help. Vitamin C, to prevent a good dose, is 1 to 2 grams a day. If you have too much, you get diarrhea, so you back off. But if you have an infection, try to go to 5 to 10 grams a day, because this will make a big difference. And the zinc is between 50 and 100 milligrams a day for if you have an infection. 25 to 50 milligrams in prevention may be sufficient. Now, these are important treatments, but you have hormone treatments. What we advise our patients, if they have an adrenal deficiency, is to increase the cortisol dose. Hydrocortisone, for example, a normal dose is 20 to 30 milligrams a day. Well, you increase every half hour. When you start having deficiency, the first 6 hours having a sore throat or having the impression of having the flu, every half hour you give 5 milligrams up to 10 milligrams, and this during 2 or 3 hours maximum. You also increase your DHEA, because people who have adrenal deficiency, they also take DHEA. We advise our patients to increase the dose very quickly. If you do that, within 2 hours, the infection will most probably be gone. If you had a delay, if you started too late, like 1 or 2 days later, it won't work as well. In that case, what we advise is to increase your cortisol dose by 50% more during 5 days, and that may help. Also, DHEA has to be increased because DHEA is the protector. Cortisol may never be given without DHEA or anabolic hormones that protect you against any side effects of the cortisol. So that's really helpful. And then there is a treatment that, bizarre, comes from China. They were the first to make it. Thymosin alpha-1, very registered in Italy, in Europe, is registered in 33 countries, officially in pharmacies, like in Malaysia, like China, of course, many Asian countries, but some countries also, and normally it is also registered in the United States. In that case, thymosin alpha-1 at a dose of 0.05 milligrams a day helps you to prevent almost any viral infection. I have no virus infections since years, just because I'm taking that amount of thymosin alpha-1. Now, if you have the coronavirus and you get this infection, I really advise you to increase the dose, like 3 times more, up to 0.15 milligrams, 0.15 milligrams a day. And that will really be helpful to get over. You do this during 2-3 weeks, and you will see the difference. It really helps quickly and strongly to get rid of the infections. You probably may have, after 3 days or 4 days, feel already much better. I can never promise, but this is really very helpful tools. And so this coronavirus epidemic actually should orient us also to another point. Avoiding contacts is good, but if you get the infection, you also get immune goblins against, so you are able to protect yourself in the future against that type of coronavirus. So getting the infection is not necessarily a bad thing, but you need to, of course, survive it. And we have tools to survive it. So the message is that you can do a lot to prevent the disease and a lot to cure the diseases by stimulating the immune system. And so please do this. Start by putting more humidity in your rooms.